This Women's Month, we honor remarkable South African women, and one of them is pioneering black female plastic surgeon Gloria Tshukudu. I have no idea how she made time for us this morning with her busy schedule. She's a senior consultant at George Mukhari Hospital and also works at the Mediclinic Muelmed in Pretoria and the Mediclinic Legae in Mabopane. Dr. Tshukudu joins us virtually. Doctor, thank you so much for your time. When you hear the title of first black female plastic surgeon, what does that mean to you? Or is the fact that you are the best at what you do more important?
Oh, what can I say? Good morning. The first black female plastic surgeon. Yes, it sounds very nice. I'm happy to hear that. But it's just the first black. There should be others. That's what I can say. I cannot only be the one.
Absolutely. How did you decide that this was going to be your field of expertise and this is what you wanted to specialize in?
I always wanted to be a doctor from a young age. You know, back then when we grew up, there was nothing about plastic surgery. The only thing that we knew about plastic surgery was that it was for the white people. And it was only about the boob job or the nose job. So after my training as an intern and then going back, I went to plastic surgery. And then when I was rotating in plastic surgery, that was an eye-opener. I realized that plastic surgery was not only about the boob job, it was also about other things like cosmetic surgery. The boob job was one of them. The tummy tucks and the liposuction is part of plastic surgery. There's also the reconstructive part where we manage children with birth defects. We do scar revision and trauma-related problems from other disciplines and also our own, you know. And after doing that, I was hooked. So after I went to plastic surgery, did my rotation and did my specialty, just after completion, I was thrown into the deep end. I was asked to head the unit in our pediatric plastic surgery. And my training was only limited to the plastic surgery that I was done during training. But I think, to answer your question, being rotating in plastic surgery was an eye-opener, and I realized that things are done differently. There's no plastic that is put there. We can manage and help people and transform their life for the better. That's why I got hooked.
Now, you would have, because you are of a certain generation, you would have been the first to do many things, possibly the first in your family, but probably the first in certain rooms that looked a certain way until you came along. The first woman to be in certain rooms when you were being trained, the first black woman specifically as well. What was that like when you were a young doctor making your way into your speciality?
As a young doctor, you know, like I'll give an example, doing rounds for an example. You find that you are doing is a multidisciplinary ward round with the occupational therapists, the male nurses, and other disciplines. You know, the patient will refer you as the sister, nursing sister, whereas they'll refer to any other person as a doctor, like the occupational therapist, because she's white, it will be referred as a doctor. The male nurse will also be referred to a doctor, but I, as a doctor, I was referred to as a nursing sister. So I have to get used to that and also have to teach the patient that I'm a doctor. Just because I'm female, that doesn't mean that I'm not a doctor.
Did that ever make you feel angry or frustrated?
Sometimes, but you know, we have to understand as people that not everyone is as knowledgeable as you are. Like even when you go to the clinic, some patients will ask you, "Are you a doctor? How many years have you been a doctor?" It's like they are questioning your capabilities. Initially, you'll get angry, but you realize that maybe people, they just want to know. You know, like you cannot just trust anyone. So with time, I learned to accept and then inform them with a smile that yes, I'm a doctor.
Indeed,
and
indeed so. Just very quickly, we really have run out of time. In 30 seconds, if somebody is thinking about what to specialize in, why do you think more women need to consider plastic surgery as a speciality?
First of all, most people who come for plastic surgery are women. Yes, they are meant to. So it would be easier for our female population to relate and discuss the problems with the women. And also, it's not only about being female. The other thing is we have to change the narrative. Make sure that people understand that women cannot just be nurses or can be psychologists. We can be surgeons too. We have to break that glass ceiling and make sure that people, and also being women are always game changers. They can drive this change. So if they join the group, then they can be surgeons and good at their job too.
Absolutely.
So there's also this, pardon?
I was just about to say thank you so much for sharing that, and hopefully a seed has been planted by somebody watching, this morning, looking for that bit of inspiration. Dr. Gloria Tshukudu, a well-known plastic surgeon, joining us this morning.